Hi, thanks for signing up for Joyous. We wanted to tell you a bit about what to expect and what's important about this treatment. In your appointment, you and your provider will review your history and make sure this is the right medicine for you. If it is, your provider will send in your prescription and it will be prepared and shipped to your home within 5 to 7 days using USPS Priority 2 to 3 day shipping. Once shipped, you will receive a tracking link via text, and upon arrival, you will be asked to tell us when you plan to start your medicine. It's important for us to know this so that we can provide you with your daily guidance on what dose to take and when to take it. We'll also send you a link for your daily check-ins. Because this is a telehealth service, there are certain requirements to being part of the program. We are unable to monitor you in person, so it's very important that you provide us with input so that we know how your treatment is going. This means that the check-ins are super important. We use the input that you provide to adjust your recommendations. You may be surprised to see how much your input influences your treatment. Most days, this check-in takes about 30 seconds, and once a week, we send a longer version to track your symptoms as well. Once a month, we'll also send you a health survey to monitor your overall health. Again, because this is a telehealth service, you will need to complete your check-ins and monthly health surveys consistently. In the first 3 weeks, we'll need at least 7 check-ins from you in order to continue prescribing this medication going forward. After 6 weeks, if you have discovered your optimal dose, you will be given the option to switch to less frequent check-ins, and then we will only ask you to complete 1 per week. Even if you don't complete a check-in every week, we'll need a bare minimum of 1 check-in every month in order to keep you in the program and send your refills. You'll be invited to a first follow-up appointment with your provider at about a month into treatment. It can be a bit sooner or a bit later, depending on what dose you end up settling at, which changes how quickly you run out of your first month's supply. If your dose increases quickly within the first month, we may send you a refill before your first follow-up to ensure you do not run out of medication. After the first follow-up, we will invite you to additional follow-up appointments as needed, mostly when your prescription needs to be adjusted or if 3 months have passed since your last appointment. If you have had a recent dose adjustment, please give it a bit of time before scheduling another consultation. Sometimes it takes a few weeks to really figure out if the new dose is working for you. At Joyous, we communicate with you by text. You can text our care team anytime 9 a.m. to 5 p.m. Pacific on weekdays, and we'll respond to you as quickly as we can. The care team is made up of non-medical personnel and registered nurses, so we can assist you with whatever you may need. Your medicine will be a little waxy lozenge called a troche. You take it by placing it between your upper jaw and cheek here. Pay attention to your troche strength and recommended dose to figure out how much of your troche to take. For example, most of our patients receive 60 milligram troches to start with and are recommended to start at 15 milligrams, which means a quarter of 1 troche. You can cut it or bite it, whatever works for you. The good news about our dosing is that you can continue living your life as usual. You may have heard of IV ketamine experiences taking several hours, meaning people can't work normally. With our dosing, that's not the case. You shouldn't drive for a few hours after, but that's about it. You just need to find the time of day that works best for your life. Keep in mind that your recommended dosage can change without your troche strength changing. Your troche strength will only change if your prescription changes following a meeting with your provider. If you do receive a new strength for your troches, make sure to change how much you take to match your recommended dosage. For example, if you were taking 75 milligrams with a 60 milligram troche, you would be taking 1.25 troches. And after your follow-up, you may receive an 80 milligram strength prescription. So at that point, you want to make sure you're taking just 1 troche and not 1.25 anymore. One important thing to understand is that you need to give this medicine time to work. Everyone's experience is different and changes based on what other medications you're taking, how long you've lived with your symptoms, and other individual factors. Some people read about other people's experiences of symptom improvement within 2 to 3 days and then feel discouraged if the same doesn't happen for them. Don't do this. Every brain is different, and it may take yours several weeks to really feel the effects, and this is normal. Be patient and don't fall prey to what's known as the nocebo effect, where research has demonstrated that believing something isn't working actually makes it less likely to work. We have found that friends and family sometimes notice effects before patients do, so ask them for feedback, and you may be surprised by what you hear. If you have any questions, we're always here for you, so reach out. Thank you so much for being here with us. We hope your journey is a wonderful one.